welcome to the first Alzheimer.tv news bulletin, an initiative of the MoCA Clinic and Institute. Each week, our team will present you with up-to-date information to keep you in touch with the most recent developments in Alzheimer's research, with the help of specialists and credible scientific sources from all around the world. In the quest to cure Alzheimer's disease, very few treatments make it to human testing, and even fewer show positive results. Until today, a new treatment for Alzheimer's has just been successfully tested in Massachusetts. Kaya, you have the details.
Yes, Eric. For the first time, a treatment for Alzheimer's disease has significantly reduced the amyloid plaques in the majority of the patients in the very early stages of Alzheimer's. Amyloid plaques are believed to play a crucial role in the development of symptoms of the disease. Over 54 weeks, the patients also showed a significant slowing of their cognitive decline. The pharmaceutical firm Biogen has tested the Aducanumab treatment on 166 patients. A dose and time-dependent reduction of amyloid plaque was observed in patients who received the treatment instead of the placebo. The very encouraging results have been shared with the scientific community in an international conference last March in France. As the third phase of testing begins, here to comment is Dr. Jeffrey Cummings, director of the Lou Ruvo Center for Brain Health of the Cleveland Clinic in Las Vegas.
I, like so many scientists, have been looking for an agent that had a convincing biomarker effect and a convincing cognitive benefit. And I think Aducanumab, the data set on this small group of patients seems to fulfill those criteria. The fact that it was dose-related, the fact it was time-related, that it was independent of disease state, these are very, very encouraging signs, and I'm delighted that Biogen is advancing the drug into phase 3 to allow us to see its effect in a larger number of patients.
Are there any side effects to the drug, Kaya?
Some mainly symptomless amyloid-related imaging abnormalities were observed in half of the patients carrying a very specific gene, the E4. It was also common to experience headaches.
Do we know when it's going to be available to the public?
Not before 2021, according to Dr. Cummings.
I think a time frame of 6 years is probably realistic in terms of if the trials went smoothly, if the FDA submission went quickly, when we could expect a drug on the market and widely available.
We know that lifestyle plays a crucial role in the development of Alzheimer's, and there's a new study to prove it. Kaya is here to talk about it.
A randomized controlled trial, which involved more than 1,000 people in Finland, revealed that healthy life choices may prevent cognitive decline in at-risk elderly people. The National Institute for Health and Welfare of Finland conducted the FINGER study between 2009 and 2011. The results were shared with the scientific community in March in the Lancet journal. All subjects in the study were aged between 60 and 77 years old and were at risk for dementia. Half of the patients were included in a healthy lifestyle intervention program, while the other half was only encouraged to do so. The intervention group had to exercise both physically and cognitively to consume a specific low-fat diet rich in fruits, vegetables, proteins, fibers, and to be socially active. After 2 years of intervention, the results are impressive.
So what we saw was that the group that received this kind of multi-domain intervention, their cognitive function showed 25% better. They showed 25% better change or trajectory in their cognition. So it was quite a big difference between the two groups. So this is really the first and large, quite long-term intervention where we try actively to change many of the known risk factors at the same time. And we were able to show that this kind of intervention does have a positive effect on the cognition of the participants. So we are very happy about this result.
Deteriorating white matter in the brain may be an early indicator of Alzheimer's disease, according to the San Raffaele Scientific Institute in Milan, Italy. Researchers used a specialized MRI technique to observe white matter instead of gray matter in patients suffering from 3 forms of atypical Alzheimer's. All 53 patients of the study presented extensive damage to white matter, displayed here in green. This shows that atypical Alzheimer's travels along white matter fibers before we can observe cortical atrophy. This discovery could enable doctors to diagnose atypical Alzheimer's earlier. A new app by Samsung could help Alzheimer's patients to remember their loved ones. Backup Memory is an Android tool which uses Bluetooth to identify nearby relatives using the app. The app shows the users photographs and videos of their relatives so the patients may recall them. The app is available through Google Play in French or English. France is about to follow the footsteps of Netherlands and its De Hoogeveisk, a small village dedicated to people with advanced dementia. The village, located in Weesp near Amsterdam, inspired Henri Emmanuali, a departmental advisor in Land. 152 people suffering mostly from Alzheimer's live a quite normal life in De Hoogeveisk, with a theater, gardens, and a coffee shop. The village in France would be set in the region of Land and hopefully be inaugurated in 2017.
If you are especially interested about all things related to Alzheimer's, we invite you to visit our Alzheimer.tv website, where you will find even more information on the recent discoveries about this disease. This site complements our news bulletin and takes a new approach to Alzheimer's, treating the disease like an investigation, where renowned experts, our lead investigators, carefully dissect and analyze all the evidence and leads. Our goal is to build the required cooperation and synergy among the international scientific community so that one day we may say, case solved.
Although the cause of sporadic Alzheimer's disease is still unknown, we do know some facts. It could be hereditary, but not only. Lifestyle greatly influences the chances of developing Alzheimer's, as well as the speed of the cognitive decline. According to Canadian studies on identical twins with the same genes, 60% of the global risk of having Alzheimer's is caused by lifestyle instead of heredity. This is why lifestyle is an exhibit in the Alzheimer.tv investigation. Here are the recognized lifestyle factors: education, nutrition, physical, cognitive, and social activity, sleep, smoking, and alcohol use. We know that education protects against dementia, but the quantity and quality remain to be proven. Some studies suggest that leading an active life with lots of hobbies might be beneficial. Others have suggested that spending more time in education is associated with a lower risk. This tab of the Finnish finger study shows what factor is associated with the higher risk of developing Alzheimer's. Each factor, modifiable or not, gives points. The more points you have, the more risk you may develop Alzheimer's. At midlife, if you have less than 9 years of education, you have a higher risk than if you have obesity or high cholesterol. Yes, cholesterol is a factor, and obesity too. Alzheimer's seems to be prevented by eating a healthy, balanced diet with lots of fibers, fish, fruit, and vegetables, and low amounts of saturated fat. A Mediterranean diet with lots of fish and veggies would be a wise choice, as well as eating 4 to 6 small meals instead of 3 big. As for supplements like omega-3, their positive effect against Alzheimer's is yet to be proven. Both obesity and lack of physical activity are dangerous, as they cause diabetes and high blood pressure, which are known causes to Alzheimer's. A little exercise is better than no exercise at all, because physical activity promotes the circulation of blood to the brain with its nutrients and oxygen. It may even encourage the development of new cells. You may also maintain old friendships and form new ones. Social activity is essential. Mental stimulation helps too, like learning a language, doing puzzles, playing strategy games and riddles, or practicing memorization. The American Active Study, which involved nearly 3,000 seniors, revealed that 10 sessions of memory, reasoning, and speed of processing training not only improve cognitive functioning, but show long-lasting improvements up to 10 years later. Sleep deprivation can significantly affect your function, memory, and mood. Evidence shows that smoking increases the chances of developing Alzheimer's and vascular dementia by 45%. Studies show that this risk could be avoided just by quitting. People who drink moderate amounts of alcohol have the least chances of having Alzheimer's, even less than non-drinkers. Red wine is particularly recommended. On the other hand, heavy drinking is ranked 5th among the most important causes of Alzheimer's. One should respect the alcohol limits advised. These were all modifiable lifestyle factors of Alzheimer's. But sadly, you can lead the healthiest lifestyle there is and still develop the disease. We still can't fully understand why. That's why we at Alzheimer.tv keep our eyes open in the hopes of one day closing the Alzheimer's investigation.
Don't miss the next edition of the Alzheimer.tv News Bulletin, where Kaya will present another exhibit from the Alzheimer's investigation.
We have with us today Dr. Nasreddine, neurologist and founder of the MoCA Clinic and Institute and chief investigator of the Alzheimer crime scene. Dr. Nasreddine, can we go over the main findings and evidence of the crime scene investigation?
Thank you, Kaya. Let's start from the beginning. In 1906, Dr. Louis Alzheimer examined the brain of the first victim, Auguste Deterre, a 56-year-old patient who was suffering from confusion and psychosis. He found two potential partners in crime. The first suspect was an abnormal plaque deposit around the neurons, and the second was abnormal tangles inside the neurons. He also found severe neuronal loss in certain brain areas. It was until 1984 investigators uncovered the plaque's identity and found they were composed of a protein called beta amyloid. Then in 1986, researchers uncovered the identity of the tangles and found they were composed of a protein called tau.
What does tau normally do in the neuron?
Tau is involved in the structure of the microtubules, which are involved in the transport system inside the neuron. When tau is disrupted, the transport system is impaired and the neurons stop functioning.
When did they discover that genetics were involved?
It was not until 1987 before the first gene involved in Alzheimer's disease was discovered. It was called the amyloid precursor protein gene, which is coded on chromosome 21. And amyloid precursor protein is the parent protein for beta amyloid. And then, interestingly, we found that patients with or subject with trisomy 21 or Down syndrome who carry 3 copies of that gene suffer from early onset Alzheimer's in their 30s or 40s, probably because we had 3 copies of that gene, which makes them produce more amyloid.
Dr. Nasreddine, can you tell us where we're at in 2015?
Yes, Kaya, let's jump forward to 2015. Several other genes have now been discovered that either cause early onset Alzheimer's, such as presenilin 1 gene on chromosome 14, presenilin 2 gene on chromosome 1, or the amyloid precursor protein gene, which is already discovered on chromosome 21. They usually cause early onset Alzheimer's, but the late onset Alzheimer's disease has been related to the ApoE gene, ApoE4 gene, which was discovered on chromosome 19. And interestingly, all discovered genes were related to the metabolism of amyloid.
Do you mean amyloid remains an important suspect in the investigation?
Yes, the current crime scene hypothesis still points its finger to amyloid as being the prime suspect in this investigation. Let's look at an important diagram that summarizes the latest discoveries. We currently suspect that amyloid starts to deposit abnormally in the brain up to 25 years before the onset of memory loss. This is the purple and red line on the diagram. The toxicity of amyloid, along with other factors such as genetics, inflammation around the plaques, lifestyle, environmental and vascular risk factors, lead to neuronal toxicity and the formation of tau tangles inside the neurons, which leads to the release of the protein tau from the tangles inside degenerated neurons. This is the light blue line, which shows that tau levels are increasing in the cerebrospinal fluid. The brain then starts showing signs of shrinkage or atrophy on the MRI scan and decreased glucose uptake on the PET scan. This is the dark blue line. Then memory impairment starts to be noticed by the victim and the family. This is the green line. The green line may start early or late in an individual depending on environmental, lifestyle, or genetic factors.
Dr. Nasreddine, can you tell us where we're at currently with therapy?
Yes, currently approved medication are working only on symptoms. They are essentially acting on increasing the level of certain neurotransmitters such as acetylcholine. Their effect tends to decrease with time as the neurodegenerative process progresses.
And what about anti-amyloid therapies?
So far, anti-amyloid therapies have failed to stop disease progression when treating the victims who are in the dementia stage, and even in one single study at the MCI mild cognitive impairment stage. But a new phase 1 study by Biogen brings back hope that monoclonal antibodies against amyloid given in a higher dosage may make a difference on the progression of the illness when treated in its earliest symptomatic stage. Also, other studies are now looking at targeting the other important protein called tau, which accumulates in the brain, as it remains an important suspect in the cause of the illness.
Shouldn't we be treating even earlier?
You are right. We should be intervening at the onset of the illness, which means at least 25 years before the first signs of memory loss, as we saw on the diagram. Unfortunately, it would take too long to see the results of the study to determine which intervention is useful. Several studies are underway to treat high-risk individuals, such as subjects with an important family history of Alzheimer's disease, with anti-amyloid agents at the preclinical stage, meaning that they do not exhibit memory loss. Mostly, the therapies would start 5 years before the onset of the disease in their parents.
What about non-pharmacological intervention and prevention?
New studies, such as the FINGER study from Finland, are encouraging in terms of prevention, since lifestyle factors, including managing vascular risk factors, maintaining a healthy diet and weight, physical, cognitive, and social activities can significantly reduce the risk of cognitive decline, even after a short 2-year intervention program in relatively healthy elderly.
Dr. Nasreddine, can you summarize the findings of this investigation in terms of all the suspects and witnesses?
It would be too long, Kaya, to summarize all the information about the suspects and innocent bystanders and protective factors, though this table will summarize the main factors. Here we see that we have the major suspects, who are genetic, amyloid, tau, inflammation, and we have also negative collaborators such as high blood pressure, diabetes, high cholesterol, obesity, smoking, and excessive drinking. We have good news because we have protective elements such as the Mediterranean diet, red wine obviously in moderation, physical activity, cognitive activity, and social activity.
Thank you, Dr. Nasreddine, for this update.
Thank you, Kaya.
As you can see, the Alzheimer.tv project is a one-of-a-kind opportunity for the general public, as well as the international scientific community, to get a better understanding of this complex disease. As our main objective is to solve the case, we need you, scientific leaders in Alzheimer-related fields, to reach out to us and become lead investigators. Only with your help can we leap forward and change the future of this disease. Thank you for watching.